Welcome back, everybody. This Week in America, website thisweekinamerica.us. Great to have you with us on the program. As mentioned, our guest on the show today is Dr. Kevin Ryan, board certified in internal medicine, hematology, oncology, retired decorated full colonel from the U.S. Air Force, and a cancer survivor. Author of the book, When Tumor is the Rumor and Cancer is the Answer. This has been described as a book that's a must-read for any cancer patient and their family. And Dr. Ryan with us on This Week in America. Doctor, welcome to the program. It's great to have you with us.
Thanks a lot, Rick. I appreciate all that we went through with setting this up on Skype. Thank you.
Well, yes, and you'll see a video version of this when you go to our website, thisweekinamerica.us. Go to the YouTube icon, and you'll be able to actually see the interview. That's also up on iTunes and, of course, on stations all across the country. This really is an important book, as I mentioned. It's a book that's been described as one of a kind, as a must-read. Why and when did you decide to write this book? You've dealt with cancer patients throughout your medical career. When did you decide, I really need to sit down and put a book together because I need to pass along my knowledge to help people through what is a devastating set of circumstances in their lives?
Two things happened. One was I had a patient who was a retired senior officer with a deadly disease, multiple myeloma. And right before that, I had diagnosed on myself a malignant melanoma right in my left antecubital fossa. That's the elbow on the opposite side of the elbow. It's right in that area there where they put IVs. I looked at it, saw this is not good, took it off, went down to pathology, and I had a stage 2 melanoma, and no one talked to me about it. There was no support to talk about. There was no therapy. There were some people who said, take the lymph nodes out of your arm. That had never been proven to work, and I was not going to have a swollen arm the rest of my life. So I had a huge amount of anxiety. And I was telling him, because we had become very close confidants, and he was about to die within the next 1 or 2 weeks. He just couldn't keep up with his disease with transfusions and what have you. To me, you need to write a book and publish it at the end of your career. You're going to have events and you're going to learn things from the patients that aren't happening. He said, you talk to me more and spend more time with me than even the medical students. I know how anxious you are, so I suggest the first chapter be anxiety. And from then on, because I had anxiety, from then on, the patients and the families and their friends and their loved ones and people associated closely with them kept teaching me more about how to be a man, how to be a physician, how to be humane, how to be professional, how to be an oncologist, how to be a full colonel. I was also a professor, full professor at the time. They taught me, and I made sure they had input into, what do you think about a chapter on this or a chapter on that? Because we're writing a book, and I didn't even have to finish, they said, a book for newly diagnosed people. There really isn't one out there that covers all need to be covered. I said, that's right.
And what's amazing is you're answering questions that I'm sure everyone has as I'm reading through the book, especially the chapter lineup. It follows in sequence where actually you are as you're going through this process. Our guest on the program is Dr. Kevin Ryan. The book is When Tumor is the Rumor and Cancer is the Answer. Website is very simple. It's thebook.com. When Tumor is the Rumor and Cancer is the Answer.com. You can, of course, go to our website, thisweekinamerica.us, and link on directly to Dr. Ryan's book. This really has been helpful to literally thousands of people as they've been able to read the book, and you walk them through the process. And let's talk about anxiety.
Yes.
You'd mentioned that you went through that stage of anxiety, and you understand pretty much what's going on, and you still went through anxiety. And in the book, When Tumor is the Rumor and Cancer is the Answer, you talk about anxiety, and it's actually different than fear. Talk about anxiety and how we deal with that.
Well, first we'll start briefly with, you said I dealt with it. Well, that was the point. I took action against fear of the unknown. And anxiety, if you think about it, whether it's a test, a driver's test for a young kid, something, a major move in a marriage that's going to occur, a new job that you don't know if it'll work out. Fear of the unknown is anxiety. Fear are the same physical feelings, but you know what you're fighting, and you know what resources to marshal, and you can come up with a plan. When it's anxiety, you have no idea which way the enemy's coming. Imagine, if you will, two different groups the time of the Neanderthal. Now, none of this is going to be evolutionarily correct, but just go with me.
Yes.
One group is inside saying, "Oh my God, oh no, we can't get out. We can't get out of this cave. We can't. We go out of this cave, we're going to be eaten. That's it. That's the end. It's over. We're going to be attacked by a saber-toothed tiger. I don't know. You name it. They're going to eat us. We're dead meat." In the other cave, just on the other side of the hill, about the same size clan, and they're in there making spears to throw and daggers and shields and picking the right size rocks, because they intend to get out of the cave and fight their way to survival. They are afraid. You'd be nuts not to when you consider what's out there, but they're taking action. The first group will die as a result of anxiety. It sucks your soul right out of you. That's why it's first among a couple of chapters, with autonomy being second. That's why anxiety is first, because there isn't a single one I have ever met who didn't have it and was thirsting for knowledge. When you consider that 45 to 50% of the population will either get cancer or be associated with someone with cancer, well, seems to me you're going to want to know a lot about this beast that comes in many forms and faces and has many ways to try and hurt you and take your life.
The time will go by too quickly, and we will have Dr. Ryan on next week's show, because there's so many important things that we need to talk about. Again, especially since you've got about, a 50% chance that you will be touched by cancer in your lifetime. If you just look around you and figure 2 out of 4 people will be touched by cancer, it's very important, and it's something that we're going to talk about the rest of this program as well as next week. The book is filled with knowledge, easy to read, common sense knowledge. And you talk about the fear of the unknown can actually kill you. And you are giving us that element, that knowledge that, okay, we at least understand now what we're going through. You mentioned the word autonomy, which you say is the single most important word and concept. Talk about that, because so many of us, I believe, go through this. We're shell-shocked, and we have a tendency to listen and to be directed as we go through this process. And you're saying that's not what you're supposed to be doing.
It's very understandable, it's very normal, it's very natural, and it's very non-helpful. Autonomy, back in 1896 in the Supreme Court, had kind of enough of doctors and others doing things to patients without the clear consent, which means informed consent, of the patient. There's a difference between, doctor, you can take my raffinator out and connect it to my tooth snot. They don't know what a raffinator or a tooth snot is, neither do I.
Yes.
So autonomy has been ruled very clearly in multiple Supreme Court decisions as the patient has the control over their body until they are no longer competent. Then it goes to the legal next of kin, or whoever is stated in the appropriate living will or other paperwork. Autonomy, no, in the first 2-3 minutes, you're not going to have autonomy. But when a doctor walks up to you, like I did in our clinic, and does something very unusual, the instructions that all of my staff had were put out their hand, look them in the eyes, smile, and say, "Thank you." They're going to wonder what in the hell is going on. They're thanking me, and then tell them, "Thank you for picking us to trust your life in our hands." And that's a little bit of control, isn't it?
Yes.
That patient's starting to have. You're switching the tables away from them having so much fear and telling them, you made an autonomous decision. You made a decision to come here. And that's when you judge what's the physical space that they're comfortable with, what level of spirituality they're functioning at the present time, making sure they have a scribe to write notes. That's autonomy. They have information, they write notes of what you say, because you want them to remember what you said. And you tell them that the goal is for them to become the co-captain of the ship, another Supreme Court term, as you go down this journey, and it's continuous and nonstop. Every decision that's made, even if it's trivial, it only takes a few seconds. If you've done the right teaching, you'll spend less time. They will not have the same anxiety. Their fear will now become a mighty hero or heroine, and they will do better clinically when they are more participating in their disease instead of having a sense of helplessness. And we all know that what I just said is true. The key is to do it and to recognize when you have a physician that unfortunately thinks MD means magnificent demagogue. If you do, either tell them and stay with them because you think they're good and maybe they'll learn, or there's nobody else to work with, or find another doctor.
You know,
You want someone who's going to team with you and respect your autonomy, to diminish your anxiety, to increase your fighting fear, and you'll be a hero. I've never seen one fail.
it follows that easily in the book as well. That's simply in the book. The book is When Tumor is the Rumor and Cancer is the Answer. Dr. Kevin Ryan, our guest on the program, the author of the book. His website is very simple, When Tumor is the Rumor and Cancer is the Answer.com. You can link on directly by going to our website, thisweekinamerica.us, link on directly to Dr. Ryan's website. Let's talk about that and how to develop that rapport. And you say that doctors are not demagogues, that we really need to establish we are the captain of this ship. And we'll talk about teamwork in a second. What if the doctor is like, excuse me, I'm the one that went to medical school. I will be telling you what's going to happen. How do we break down that barrier? And at what point do we say, okay, I really, for my sake, I need to move on?
You do it directly and just like your mom would tell you, directly and appropriately and understandingly. You don't want to judge clinical abilities. You first make a try and say, Doctor, I'm a real believer in patient-centered care. I'm not a doctor. I know that. But I will understand what you tell me, or I'll ask you to explain it to me. And it would seem to me that you would be much more comfortable with a patient that knows what's going on. If things go good, that's a wonderful thing. You can celebrate together. And if things go bad and I'm doing poorly, you will have prepared me for that. And won't that alleviate a big burden from your heart and soul, which I know you have, and I know as an oncologist, you have to protect it to a certain degree because you have so many patients. That is the tactical way that is usually the most effective, along with eye contact, squaring off in front of them in your body position, if you can, standing and talking to them, even better, sitting across from them, and maybe shake their hand and hold on to it and talk to them, talk with them, connect to the person inside them. Oncologists are not the greatest talkers in the world. They don't talk too much about oncology being very difficult among themselves. It's getting better, and they don't spend a lot of time talking to their patients about what's happening. There are many exceptions, and it is getting better. But a lot of doctors don't. Some that do, family practice doctors, are usually wonderful at talking and explaining to their patients, where are we going, why are we going there, here are our choices. It's a tough, tough, tough field for the doctor and the staff as well. You're shuttling people either off this mortal coil with all kinds of problems and pain and suffering and indignities, maybe, or you're fighting this great fight, boxing with God, and he spots you around and say, okay, kid, you got this one, you win, and you have a cured patient. But you don't know yet.
Tell me
And
about,
that's on the shoulders of the doctor.
you mentioned this before. Let's talk about mindset, because I believe there have been studies, in the process at least of being studies, that there's a link between depression and not doing as well as could be expected, as should be expected, going through the chemo, the therapy process. Talk about the role of mindset, how important that is to have the right mindset.
I'll tell you, Rick, you're asking all the right questions. First of all, we're not a shank of hair and a pound of flesh. And I'm not going to evangelize or proselytize, I am a Christian. There are other major faiths that feel the same way, that spirituality is real. And thus, when we look at how marvelously and miraculously we're made, it'd be kind of silly in the setting of, don't you have emotions of love? How do you put your hand around that? But you feel it and you think it. Fear, anxiety, anger, rage, animosity, jealousy, envy, anticipation. We have all these feelings. Where do they come from? Well, they come from inside your brain, thoughts. So where do the thoughts come from? Well, the way we're wired, God has made us able to have those thoughts. Now, tell somebody who is alive that they may die, and I doubt they're going to have a party. I've recommended it occasionally that they have a party when they're in a remission and celebrate it. But when you tell someone that they're going to die, or could, or the odds are high, or the fight is going to be very, very harrowing and very difficult, you've got to look for one of those extra vital signs besides blood pressure and breathing and temperature and pulse and pain. At every visit and at every phone call from the family, with permission from the patient, of course, or the patient, you assess for depression. It is estimated that over 70% of oncology patients go through periods of depression, and about 25% are eventually treated. And depression is usually very treatable, especially if the cancer is getting better. Depression is hell. It's a blackness, a darkness. It's a lost soul in a forest that sees no way out. It's a person believing the never and forever lie. It will never change. It will forever be this way. Why is it worth it? You have to know and look for those things, because there are medications which can help a great deal of the time, and if necessary, psychological or psychiatric counseling going along with it for the appropriate amount of time to assist this patient. Also look for it in the family and talk to the family with the person in the family with depression and say, I think you're having issues, and those issues could be affecting your loved one, the patient. So perhaps we need to talk about making a referral for you to get some help so you can be with your loved one with a more positive attitude. That's tricky stuff to do, but I've done it because there were people who were really dragging the patient down in the family, and that's no surprise. And it's worked. It's worked. So that's your connection.
All of this and so much more. We've just touched the surface. That's why Dr. Kevin Ryan, our guest on the program, will be back with us next week on This Week in America. The book is a really important book, one of a kind. When Tumor is the Rumor and Cancer is the Answer. His website, very simple. It's thebook.com. When Tumor is the Rumor and Cancer is the Answer.com. We've touched the surface. So much to pick up on when we continue the discussion next week. Dr. Ryan, congratulations on a book that I know has touched thousands of people. We've only touched the surface here on this program. We'll have you back next week and we'll go further into it. Thank you for being with us on the program. It's very important.
Thank you very much.
You're listening to This Week in America. All the information on Dr. Ryan and his book available at our website, thisweekinamerica.us. The book, once again, When Tumor is the Rumor and Cancer is the Answer. Our guest has been Dr. Kevin Ryan. You're listening to This Week in America.